The bill that became law for another $8 million in terms of our region, some of it, not all of it. But, you know, I'm going to continue to fight in terms of these environmental issues, especially on red tide and water quality. I've made it very clear to a lot of people over the years, as a kid that grew up in Michigan and Lake Erie was polluted. I just remember as a kid you couldn't swim in it, and if you did swim or try to catch a fish, you couldn't eat it. I don't want that to happen here. Water quality is a big issue. Even on the chamber here locally in Sarasota, we understood, and I chaired that for a couple of years, we understood that a good environment is good business. And that's what we're talking about today, is just taking a look at what, you know, what more can we be doing in terms of red tide, not just to mitigate, to keep it at a minimum because it's a natural occurrence, but what is the impact on humans, if anything at all. So the best way to do that is to talk to the doctors and the scientists and let them give us their thoughts and their ideas. So I thought, I first want to also acknowledge Sarasota Memorial. A lot of their board members are here today. I appreciate their leadership, and it's a huge impact in this community. I remember when Sarasota got voted, or this region got voted, as the #1 best place to live and work in America by Money Magazine. I asked the guy when he came in town, what was the criteria? At the top of the list is quality health care. So with that, I want to thank them. I'd like to introduce Dr. Kurt Vulture. He's going to give us a little bit of an update from his perspective. Thanks, Doctor.
Thank you.
Yeah.
Thank you, Congressman. As a lung doctor, I routinely see the effects of red tide on our patients, elderly patients, COPD, asthma, but even those who don't have lung conditions will go outside, start coughing, have the irritants. Now that's one aspect of red tide. I've also had several physicians come up to me and say, you know, is there a correlation between this disease process I'm seeing and red tide? And my answer to them is we just don't know. We do not have that information. I've done literature search. I'm the director of clinical research here, therefore am frequently approached with questions about red tide, and we just do not have the information. And that's why I would like to thank Congressman Buchanan for starting the ball rolling on this, as we won't have any investigation or research unless there is funding for it. Somebody has to say, you know, this is important enough question to be answered, and we're willing to sponsor some research. And that's why having both Moat and Roskamp here is a wonderful wonderful thing to maybe initiate some early red tide research.
Thanks, Doctor. Let me just mention this gentleman. Sometimes people say, is anybody listening in Washington? He approached me, Dr. Mike Mullins. This has been maybe 3 or 4 months ago, and he said, and I don't know if that's exact timing, but roughly, him and others to say, this is something clearly we need to take a look at. I'm not sure where it goes, but we need the dollars to get the research. With that, Dr. Mike Mullins.
Yes, thanks very much. So the background to this is, as the Executive Director of the Roskamp Institute, we have been looking at central nervous system disorders, neurologic disorders for many years, Alzheimer's disease, Gulf War illness, traumatic brain injury. What they have in common is inflammation. So it's a natural thing for us to look at red tide and the neurotoxin that it releases, because we know from animal studies it can cause inflammation. We also know that it can accumulate in the liver and in the brain. And in our clinic, in our neurology clinic, we see folks coming and complaining about neurological symptoms which they attribute to red tide exposure. And then finally, as Kirk was just saying, we know that certain groups of individuals are very vulnerable to red tide, such as asthmatics. So what we're doing initially is looking with volunteers at the blood levels of the neurotoxin and see if that correlates with the symptoms of which they complain, but over a long period of time. And surprisingly, there are no long-term follow-up studies in humans to see whether there are long-term consequences. And we need to know the answer to that. Hopefully the answer is there aren't any problems on the neurological side and other sides, but we just need to find that out. And I must add my thanks to Congressman Buchanan for taking the lead on this. And
not least Dr. Michael Cosby. I was involved with Moat Marine for many years, a vice chair many years back, but I can tell you he's taken it to a whole nother level. He's providing a lot of leadership, Moat is, not just this region, but throughout Florida. With that, Dr. Cosby.
Thank you very much, Congressman. It's a pleasure to be here. It's really an honor to be here with the representatives from two powerhouses that we have here, Ross Camp and the Sarasota Hospital here. I really want to thank the Congressman for not just listening, and he does listen, but for being able to follow through with action. Last year, he was able to secure a significant plus-up on the environmental impact side of red tides by securing additional funding for NOAA. And this year, he's following through with really the other side of the equation, which is the human health impact side of the equation. Moat is known as a leader in the world in terms of red tide research, harmful algal bloom research, but what most people aren't aware of is that Moat also led the field component of a 7-year study looking at some of the initial linkages between red tide and human health impact here in Sarasota. That was just the beginning. It was a relatively elementary study, but we got a lot of good information out of it. And I think with the Congressman securing these funds at NIH and bringing together 3 really excellent science research institutions from the human health side, from obviously the brain side, the great work that Ross Camp does and what Moat does. I think we're putting together a great team here, and we've got someone that is really giving us the fuel to be able to look at the real impacts of this. When we look here at Sarasota Memorial alone, previous studies have calculated that there is about up to a $4 million capitalized cost of the human health problem that we have from people having to come into the emergency room during red tide. But the longer term issue of exposure is one that we really need to look at, and I think we'll be able to do that together very well, and I just want to applaud the Congressman for following through and getting us this funding.
And again, I tell people it's humble to be a congressman. I'm a representative, and my goal is if you've got something we can help with, that's my job, is to do the best I can in Washington for you. So with that, we'll open it up for any of the doctors or anybody has any questions on anything.
Yeah, this is probably a question for the doctor, but I know you may not have an exact number, but could you tell us, kind of give us an idea of how many people came in last year with symptoms of red tide, symptoms because of red tide?
Yeah. I don't have that data from you.
Yeah.
I'm sorry. The question was how many people came in last year to the emergency room, to walk-in clinics, to doctors' offices because of red tide. I do not have that. I know from our own experience in our lung doctor office, there's a significant uptick in people with exacerbations of their lung problems during the red tide blooms.
Are you concerned about some of the discoveries you may find in this study, like any real long-term terrible health impacts because of this?
Well, I think we need to know. The short answer to that is not so much concern. We just need to know. Maybe there aren't any long-term impacts in certain areas, and one way or the other, we just need to have those data.
What is your study going to look like? How are you going to do it?
So we're recruiting 400 volunteers. We take blood samples and urine samples from them when there's no red tide around. We measure the levels of neurotoxin. Then we see them again when there is a red tide around. We measure the levels again. And we see if that correlates with any symptoms that they're complaining of. And importantly, we'll look at other aspects of the red tide's effects on the neurotoxins' effects in the blood, such as inflammatory responses. So we'll look for antibodies and cells that could respond to the red tide neurotoxin. One of the basic questions that's not understood is having a robust immune response a good thing, or is it a bad thing? Do you get more symptoms if you have a strong response, or less symptoms? We don't even know the basic answers to those questions. So getting this biosample in place will not just be helpful for our studies, but actually having these samples over long periods of time will be helpful for many other researchers as well as we go forward, and they want to look at other aspects of the exposure.
Dr. Mullins, have you already designed this study? Is it already in the works, or is it only something that can happen if you're able to pull down some of this NIH funding?
No, it's already happening. Right now we're funding it with fumes. I don't know quite how we're funding it right now, but going forward, of course, we'll be applying to to the federal agencies to pull down money as we usually do for our studies.
And the 400 people, like, are they people who live on the beach? What kind of people?
So both. It's folks that that live in the area in its entirety, including some inland, because we want controls, but also people that either work or live in coastal areas. And we're asking them how much time do they spend near the water, how much time are they away from the water. We are quantifying that, and we're of course comparing that with the known amount of red tide in the water during the times that they're exposed.
Congressman, we saw a big economic drop during red tide, and a lot of that was people being afraid to come here because they didn't know what these health impacts would be if they were even in the general area of the Sun Coast. Do you think that this could help during the next red tide outbreak to just, help people feel better about what the, either way, if we know or we don't know?
The environment, as I said in the chamber, is good business. Water quality is the most important issue, I think, to Florida. And I think I've had a delegation. I brought every member together. I think we had 22 of the 27 there. And all of us agree, Democrats and Republicans, we've got to bring whatever resources we need. What I've asked them to do is provide me the science. I'll work to get you the money. And it won't be just me. It'll be a bipartisan effort. We can't afford, environmentally, to not have this work in a big way. Even Lake Okeechobee, when you see that, I've seen on CNN where you got guacamole and some animal or something's trying to move across the lake. It's a disaster for Florida. And we get 100 million visitors a year. We don't need that. I was concerned initially when the doctor came in about the impact, if they did find something, but I think you got to err on the side of doing the right thing. And I appreciate the leadership from all of these, because we've got to work together as a team, all of us. And, I remember in 1970, we had 7 million people in Florida. We got 21 million, then hundreds of millions of visitors a year. There is some human impacts on that. But what I found, I talk to 10 people. Sometimes I get to 10 different answers. That's why I go to them. I want them to have the money, the research, provide the science, and then, and wherever that takes us, it takes us. And I'll help provide the funding. And I want to also compliment the state, because they stepped up in a big way. Over the years, you get $1 million or so. I think $12, $14 million a year is going to be a great investment to help minimize the red tide. We're not going to eliminate it, from what I've been told, but we can minimize it. There are human factors involved here.
How long do you anticipate this study to go for, if you didn't already say?
Our study will probably run for 2.5, 3 years. That's what we're expecting. Yeah.
For the Ross Camp Institute, I first met you when you were out at Gulfgate. How many people have you approached you for this study, and what are their concerns when they're contacting you?
So we have 50 folks that have signed up already. We have blood banks already. It's been a great response, and their concerns are our concerns. It's the same ones we share today. Is there effect? And I think what you see is some people are much more affected than others, not just with pulmonary complaints, but with other complaints. And we need to understand that and understand why that is, and is there anything we can do about it, going forward. Yeah.
What are your hopes for the future beyond this study? Are you hoping that the drugs that you produce or do sort of warning systems?
We're always about treatment. The Institute's always about treatment. We've developed treatments for Alzheimer's disease, for Gulf War illness, and we're always looking to do that. And so this may well be amenable to treatment if specific individuals are at risk. I mean, at the end of the day, this is one molecule binding to another. You can usually interrupt that. So yeah, we'll always have our eye out for new treatments.
Dr. Crosby, maybe a question for you. Obviously, this area was devastated by red tide last year. Is there a chance in the near future we could see something like that again?
Is there a chance? Yes. There's no question about it. You don't want to sugarcoat it. It is the last event that we had was probably in the top 5 or 6 in terms of duration and intensity. It's not the worst one, but it's right up there. We don't want to see that again. I think the funding that the congressman has secured last year and now this year as well as the state funding that was quite instrumental with developing a 6-year initiative to develop mitigation technologies to fight the impacts of red tide is incredibly important. Mitigation strategies that might be able to decrease the amount of aerosolized brevetoxin. When we're talking about human health impacts and the respiratory kinds of impacts that you've heard talked about by my two colleagues here, this all stems from the fact that the brevetoxin is aerosolized from the ocean into the atmosphere and can travel inland. And those are the kinds of studies that we hope are going to allow us to have some kind of a mitigation on the aerosolization of it at the ocean itself to prevent it from getting into the atmosphere. And then there are ways that we think we will be able to develop to minimize the ability to actually inhale the brevetoxins as well. So I think, again, by the three organizations working very closely together here, we each have assets and capabilities that really can be leveraged very well together with the support of the funding that the Congressman has secured. And I think together we're going to have a huge impact on dealing with the impacts of red tide.
You know, there isn't red tide.
Let me just add one thing along that line. You know, red tide funding, I've watched it for 20 years, comes and goes as we have the bouts. This was a longer bout. But this is the first time I ever remember where it was getting into downtown Sarasota and downtown Bradenton. I've never seen that historically before. So I think, you know, this has all gone to another level, and we need to bring that level of intensity with it as well to support these organizations so we can get the proper science.
Yeah, I was going to say that this isn't something where we're seeing a lot of red tide right now in the water. You know, how accurate is it going to be doing these studies now without those high levels of red tide?
Oh, it's critically important. You have to get baseline studies, whether it's in the environment or whether it was human beings. The baseline before the red tide is here is critically important in order to assess the level of impact, whether it's the environment or whether it's humans.
Yeah, absolutely, because folks complain about symptomatology, which they attribute to red tide, even long after red tide has gone. So, again, we need to understand that. We'll look to see, we assume that the neurotoxin's gone then, but have other things gone? Have the antibodies diminished? Are other cells still reacting? We don't know that. So, as Mike says, absolutely critical that we get subjects now when there's no red tide around.
But you said this study was going to last about 3 years. Do
Yes.
you need it to last until there is a red tide event so you can really see the effects of when there is red tide around?
Well, sadly we do, yes.
Congressman, you touched on this earlier, but what is the status of your bill? So this passed as a standalone bill, or this is part of the larger funding agreement that is moved ahead in the House, and the Senate has to pass it here, and it involves the debt raising the debt ceiling as well?
Well, we're hoping that it's passed the House. So the goal is to try to get in the Senate, but it was very bipartisan, so we expect the same thing to happen in the Senate. It could be multiple vehicles, ideally, but I'm just excited about it. It has passed, and we're going to get it done.
Standalone bill in the House?
I think so, yeah. Yeah, I'll take a look at that and see, because sometimes they go multiple ways. Sometimes they get voice voted as part of a larger package or a standalone. Most things aren't standalones today that I've done over the years. Usually it's part of another package that gets done, so that might be the case.
How are you guys trying to get people to be part of this research, and what would you ask from the people in this area to be part of this research?
Well, you guys are fantastic in this regard, because you actually bring in more volunteers than our own efforts. So this is going to be very important. But yeah, social media on our website, obviously, but the more attention I think we get about it, the easier it is for us to recruit.
Is there a specific type of person or a specific type of age group? Nothing?
No.
It's totally random?
Yes.
I would only add that, and I haven't been asked this, but all age groups, but I'd like to, because we do have have the most seniors in the top 5 in the country. I want to make sure we're looking at clearly at the seniors that have, I think, and I don't know this, who have greater risk. That's just my sense of it. If they already have issues or some challenges and they're out on the water, the beach, St. Armand Circle, I want to know about that.